Hi everyone, my name is Kaylee Stevens and I'm a second year Master of Occupational Therapy student at the University of Tennessee Health Science Center. This is my in-service presentation and my topic is stress and stress management for you and your clients. Today's learning objectives. Identify the definition of stress and how it may present in your life. Identify one or more techniques to use personally or introduce to your clients to implement in their daily lives, and identify the parts of the stress cycle and how you handle stress. So before we begin talking about stress, what exactly is it? According to Medline, stress is a feeling of emotional or physical tension. It can come from any event or thought that makes you feel frustrated, angry, or nervous. Stress is your body's reaction to a challenge or demand. In short bursts, stress can be a positive, such as when it helps you avoid a dangerous situation or it helps you work a little bit harder and faster if you have a deadline to meet. You will see this again reinforced after you watch the TED Talk. However, no one wants more stress in their life. And for our clients with conditions such as COPD, high blood pressure, heart disease, and others, stress can make things even worse. Let's talk about ways stress may present in your life. While everyone is different, there are some common ways that stress may be displayed in your life. While I talk through these, think about which ones may possibly apply to you. Here are some examples: depression, feelings of hopelessness, social isolation. This can also include just not enjoying things such as going out with friends that you once used to enjoy. Forgetfulness, loss of concentration, decreased productivity, poor diet, an increase in muscle tension, an increase in anxiety, poor frustration tolerance, and emotional and physical fatigue. While these things are constantly displayed, or when these things are constantly displayed in your life or in your professional life and they're not addressed, this can easily lead to burnout. I read a study that looked at speech therapists, physical therapists, and occupational therapists and compared their levels of stress with burnout that they saw in the rehabilitation field. And while there were no significant differences in stress levels between the three professions, there was a significant difference in the stress levels of just people who work in rehab in general, because they were burning out way quicker than people in other professions. So it makes you wonder if they were just overwhelmed with work or what the common factor is in that burnout phase, that they weren't getting the help they needed or they weren't taking the time to care for themselves as they should. Now let's talk about some ways stress may be displayed in your clients. Remember, these are subject to the person and their condition, but I wanted to provide you with a few examples for you to investigate if your client displays some of these things for a longer period of time. This includes headaches, feeling overwhelmed, unexplained behavior outbursts, avoiding others, experiencing chest pain, using continuous poor judgment, having nervous behaviors, a change in their appetite, or not participating in therapy. Also, keep in mind that clients that have conditions like COPD that display shortness of breath, that can be a sign of stress, not a COPD symptom. And for them, that can be even more dangerous than another person having shortness of breath. So stress can be displayed in a lot of different ways. Now, if over time you keep seeing the same things with the client, or you know that they're just exhibiting a behavior that's completely out of the ordinary for them, maybe stop and think, maybe, oh yeah, it's not me. It's not that they don't want to do their therapy today. They're dealing with something mentally, emotionally that needs to be addressed. And since we're in a holistic profession, OT is going to be right there. We're going to notice these changes and we will be really equipped to address it. So now that we know what stress is and what it may look like, watch this TED Talk on how to make your stress your friend. I believe that we've watched this video in another class previously, but I encourage you to rewatch it again as a second year OT student and see if your thoughts have changed about stress. I know mine certainly did from the time I first watched this video to when I recently rewatched it. So watch that video. You'll need one of the answers for the knowledge check and then come back to this presentation. So now that we know what stress is and what it may look like, how do you manage your stress? What do you do when you feel like you just might explode from pressure from life, family, friends, school, or work? Take a quick minute and take the quiz that's posted on Blackboard. It's super short, but might provide you some insight on how well you're managing your stress. Remember your result for the knowledge check at the end of this video. So now let's move on to the stress cycle. I personally find that this graphic makes things a little bit easier to understand and why we may be experiencing stress about the same situation over and over. So first, we experience a stressor. For example, that might be having a big exam or big test coming up. The next part would be our reaction to stress. What would yours be? Do you immediately go study and make a Quizlet? Do you think studying's too hard, so you take a nap or just not do anything? Over time, this can cause wear and tear to your body's organs. And as a result of the stressor, you may neglect eating nutritious meals or having a healthy sleeping routine. And this in turn reduces your optimum health. Then over time, you become more sensitive to stress, especially when you hear that you have another big exam coming up in a few weeks. This cycle repeats over and over after a few weeks or months, and then you're decreasing your optimum health, especially when you have a negative view on stress or a negative view on an exam. You have to change your views in response to stress to a positive one, but that's going to take time. But in return, you'll benefit greatly, mentally and physically. So let's take a moment and brain dump out some ways that you said you would manage stress. Think back to when we did this in group practice with Dr. Booker. And according to our textbook, in Occupational Therapy for Physical Dysfunction, stress management methods help increase neurochemical levels. Effective stress management techniques include mindfulness therapy, relaxation, and cognitive behavioral therapy in combination with education on stress management techniques. This is an area that makes a valuable contribution to us as OT practitioners as we treat the whole person, mind, body, soul, whatever we need to, we're treating you holistically. So here are some ways to manage stress and create a healthy lifestyle. So these would be things like reducing your screen time on your devices, changing your light settings on devices, laptops, or phones, develop and follow a bedtime or quiet time routine, consult a doctor if needed, make a schedule, schedule out your meal times, and then schedule out times you're going to do things like exercise or spend time outside. Know your body and recognize signs of stress, anxiety. And the biggest thing is to seek help when needed, because sometimes you can't do it alone, and that's totally okay. Participate in some deep breathing, some mindfulness, attend some support groups. Share feelings verbally and non-verbally as needed. An article I read from an occupational therapist listed 5 ways to teach your clients to manage stress. I really like these because some of them are a little bit different than ones that you commonly think of. The first one that caught my attention was gratitude journaling. I think this would be a great idea and an easy way to incorporate into your intervention sessions with your clients. Just have them write down a few things they're grateful for that day. It usually will just take your mind off the things that are stressing you out and put it into a more positive focus. So hopefully that they can benefit from that during their therapy. Another one was stretching, and while not everyone can do this, it's a really good thing to incorporate just to get your blood flowing and get your mind off the stress that you're facing. Set boundaries. I found this one to be very helpful, especially when you're working from home. Like we all are now, it's really important to set boundaries so you're not overlapping your personal life with your professional life. And I think this will be even more important when we're on level 2 field work. The last one would be to use breathing techniques. And while sometimes we giggle when we do these, they're really helpful and beneficial, especially when you're alone and you're not around your friends. You can do some deep breathing techniques that can really help calm your body, mind, and spirit. AOTA also has a great resource that is a decision guide for stress and anxiety management for practitioners. I wanted to go over some of the highlights because the pamphlet's quite long. The first one they suggested was getting organized by setting a schedule and routine. And I think a lot of these things they mentioned are topics of previous in-services that would be really helpful to put those resources to use. Take time for yourself at least once a week and be patient with yourself. It's okay, we're all going to experience stress, but don't make yourself feel bad for your feelings. Use strategies to work on focusing, like setting a timer. I like to do this where I set a timer and then I will do all that I can for a 30-minute period of time. And when that's up, I'll take like a 10-minute break. That really just helps me prioritize my time, and it would prevent me from working for 4 hours straight and not even getting up to use the restroom or get a snack. Limit distractions. This one's a big one because I know working from home too, I get more stressed out because I have too many things distracting me from doing my work. Whereas if I was at school, I wouldn't have any distractions. Plan as needed for meals and personal time. I'm a big scheduler, so I like to plan out things in my planner. So if that works for you, then go for it and literally schedule out when you're going to take your meal breaks and when you're going to do something for yourself that week. Avoid busy work and agreeing to commitments that take away from areas of importance. This is another one. You don't feel like you have to say yes to everything. Do what you can, but don't overwhelm yourself or make your stress levels increase. Ultimately, it is trial and error until you find something that works best for you. I hope that you learned some effective ways to manage your stress for you and your clients. So, here is my Google form. So you can find that on Blackboard, and I will be assessing your learning from this presentation. And here are my references. So thank you so much for your time and attention. And I really hope you enjoyed this presentation. And I hope you watch that TED Talk on how you can make stress your friend. I feel like you will get so much more out of that. And especially this time around, it can be very beneficial to us as future practitioners. And also, it's important for us to have this information as we treat our future clients.